So in this fourth screencast, we're going to move on to think about how you actually go about planning a health promotion intervention. And this health promotion planning cycle is well recognised as a good way of thinking about how you're going to start that process. So you need to start with thinking, well, what are the needs that we've identified here? And I'm going to explain a bit more about that and how you do that in a little while. But based on what the needs are, you're going to define your strategy of what activities, what intervention you're going to be thinking about. And we'll talk about that. And then you implement your intervention, and then you evaluate what has happened, reflect on what's happened, learn from it, and also look to see whether it actually had the impact and outcomes that you want. So after a while, you'd be going back and saying, well, are the needs still the same? Have the needs changed? Is the situation better? So it is a cyclical process, ideally. It doesn't always happen in practice, but in the ideal world, you'd be going back to check that actually things have improved. Because if you think of those wider determinants of health, they're constantly changing. So you may have implemented something that worked, but actually, what's the long-term outcome been? And how are the needs of that community, that group of people now? So try and think of it as something that isn't a one-off event, but something that we would continue to look at. And here's 2 or 3 things that you need to be thinking about. So what position are you going to be on that continuum between coercing people, persuading people, or empowering people? What's going to be the appropriate way to go about this? Depends a little bit on the situation. Depends on your values. If you're working in the NHS, you've got your values of respect and dignity to think about. But it also impacts, the context of where you are. So what are you doing? Where are you doing it? And how important is this health problem? So what's our approach going to be? When we're thinking of methods, we need to be thinking, well, is this something that we're going to be doing kind of person to person? Our one-to-one consultations, so the kind of mainstay of dietetic practice. So are we going to be doing nutritional counselling? Or are we going to get people in a similar situation to peer educate? Are we going to lobby to local governance or, different organisations to get things changed? Are we going to work on group discussions, self-help, all of those things? But those are about going from person to person. Or we might say, actually, this is a big issue. Let's get out there on radio, TV, different social media platforms. Let's use the mass media. Lots of different ways to think about it. Not just the one, lots of different ways. But if you are doing person to person, what's your setting going to be? Now, we're going to talk about settings tomorrow. But, you've got a target group. Where's the best place to think of them, find them? Where are they going to be? So those definitions of thinking through what are we interested in here? What are we thinking we're going to do? And then the detail of it. You've assessed the need. From that, you're going to set aims, an overall aim or aims of the program intervention, and specific objectives, measurable objectives, that if you complete those objectives, you will have met your aim or aims. And then once you've got the clear idea of the objectives, then you can say, right, how are we going to do it? What methods are we going to use? What resources do we need? How are we going to evaluate? So we'll come back to our evaluation later, but you should be evaluating the outcomes against the objectives to see whether you've met your objectives. So you might be looking at effectiveness, acceptability, all sorts of different things. And you need a clearly defined action plan, timescales, milestones, so that you know that you are progressing through your intervention, through those steps, and you can identify how well you're going on your intervention, with your timelines. So it's a kind of clearly defined process, but quite a lot of detail. This isn't the kind of thing you're going to think up in half an hour. You've got to be thinking through the detail. So situation analysis. So this is thinking about, well, what's the situation here? What's going on here? What's happening now? Is there actually a need for change? Is this the way things are going, working fine? But usually we've identified somehow that something's not right, or we think it could be improved. So you're asking questions, why did this situation happen? What factors have been contributing? Is there a way that health promotion could contribute to make it better? So you might be thinking, like, well, actually, we need to change this. But we need to also think about values and the ethics. Do we have the right to intervene? Can we make people do things differently? Or can we support them to make that healthy choice? So you've really got to think through those kinds of things. Are you focusing on a specific health topic? Cardiovascular disease, diabetes, people living with overweight or obesity? Or are you thinking, actually, if we can promote a healthy diet, we can decrease risk of obesity, diabetes, cardiovascular disease, cancer? So are we just trying to promote a healthy diet altogether? So which way are you going? And what is influencing the health of this particular population that we're interested in? Are there any particular models or theories that we think, actually, if we change one thing, that's going to improve the outcomes? So a different way of looking at things. Health needs assessment is, again, a slightly different way of thinking about things, but it's a very systematic procedure of trying to work out the health needs of a particular population. And that might have come about because it's been noticed that the cardiovascular disease death rate is much higher in a particular area, or there are more people living with diabetes in that area, or actually this particular part of the city has the highest instance of people living with overweight or obesity. What are we going to do about it? So we've identified that there's something not right. But who decides on need is quite an important thing. So often it's those of us working in healthcare think, actually, that group of people really need something because they're not normal. So we compare them to the national average. And there's data you can get on national averages for a whole range of different things. So you can look at morbidity and mortality, causes of death, those kinds of things. Those statistics are all available. So you might look at a population and think, actually, their health is much, much worse than the average. You might compare them to another local community. So when you think we were looking at wider determinants of health, I mentioned about Glasgow, different areas in Glasgow having up to a 30-year difference in life expectancy. So clearly our needs are greater in one area than another. Why is that? Let's have a look and see what's going on. Or you might notice that a particular community, a situation is getting worse. So there are more evidence of ill health. People are dying younger. But that's the healthcare perspective. But it might be a community might decide that they've got an issue that they want help with. So they might, start getting together and campaigning and saying, this is what we need. And sometimes these are very practical things. We don't have good street lighting. We're not feeling safe at night. There's nowhere for our kids to go and play safely. So they might be saying, actually, if you're going to knock down that car park, let's build a park so that our kids can go and play outdoors and get more physical activity. So people might be making noise and talking about what their community needs. But sometimes communities have needs that they they feel. You know, if you were to actually ask them, they think, actually, we really do need this. But they haven't necessarily made any noise. They haven't necessarily brought it to the attention of the local authority, the councils, or whatever. So there's, you know, is it a community decided need or is it a healthcare decided need? And there's lots of data and statistics that you can look at to do a health needs assessment. So let's have a think about this, and we're going to have to discuss this as a whole group. If we were looking at an area with a very high incidence of childhood obesity, what type of information could we get to inform that? So we'll be thinking about what affects food intake, what affects physical activity, but also what affects those wider determinants of health that influence those things.